This is the lower eyelid, and look how beautiful this is, right? So we're just in a completely bloodless manner, but extremely meticulous, right? I am meticulous to the point of being ridiculous, right? So we're just gonna enter the septum orbitale, right? And then find our fat paths, and we'll show you how it goes. But absolutely no bleeding here, completely bloodless here. Thank you. Okay, so today is Friday, it's Good Friday today, and we have opened the septum orbitale and exposed the fat paths. This is the central because it's in the middle. This is the medial because it's toward the nose. It's called the nasal fat pad or medial fat pad. And the lateral fat pad is more on this side, right there. And we're gonna get to it later. But let's start with this one, okay? And there is an important muscle in between these two. It's not to cut that muscle. And as long as you are cutting into yellow fat, you're good. And notice how I am right now electrocoagulating these blood vessels. Yeah, it's probably better if you come from this side.
We're good. We're good. We're good.
Okay, you're good. You're good. Okay, so we can always take more later, but right now, you see, we're very conservative, and I'm using a Q-tip. So I cut into the Q-tip. So this is the central fat pad in a completely bloodless manner, right? And then we will address the more nasal fat pad, right? Which is right over here. And so we're gonna move to this side and address this fat pad right here, right? You can see it there, so I can tease it out with the, and see it pops out right there, you see? So you can put your finger there, so it pops out. You see, press a little bit there, so that, you see, so this is the nasal or medial, because down the middle, fat pad, and then again, I'm just basically getting whatever is yellow fat, right, out. And we cut it again to protect the eyelid and the eye globe onto a Q-tip, and that's the nasal fat pad, right? And as you can see, there's a little bit more on this side, so we're gonna take more. Actually, there's quite a bit more, and that's still part of the central. As long as this is all yellow, and we cut until it basically retracts, right? So once that, so that's more of the central. So once it retracts, then, you know, you don't have to take all of it, but otherwise it'll be hollow. But the important thing is look at the complete absence of bleeding when we do this. And now we're gonna go after this one, which is the lateral fat pad on this side, okay? Thank you. And this is part of the lateral fat pad, okay? And we're gonna take some more out later, probably. We just wanna see what pops out. So this one here, put your hand right there. And we're gonna see if we can take this one out too. See, that's a little bit, yeah. Goodies, huh? And let me have the Q-tip. Hold on to this a second. So this is part of the lateral fat pad that we're gonna take out, okay? So, same here. And there's a blood vessel there, so we electrocoagulate the blood vessel. So we do this in a completely bloodless manner. And that's all there is, you guys. Absolutely no bleeding here. Look at that. Incredible. Thank you. We opened the septum orbitale. This is a little blood vessel here, so we're gonna get it, right, before it makes any noise. Right? We don't want any bleeding. A completely bloodless field. So we have the lateral, the central, and the So this is nasal, central, and lateral fat pads. That's incredible, incredible. All right, let's go after the central first, okay? So, so basically we can get more of this fat later, but we're gonna do whatever we can see that's yellow in a completely bloodless manner. So this is the central fat pad that's out, okay? And now we're gonna go after I'm gonna expose these a little better. There's an important muscle here in between that maybe I should electrocoagulate a little bit of this blood vessel here. That provides eye movement, so we don't want to get that muscle. But as long as you're getting yellow fat and you don't have to be too aggressive, whatever we can get, we can always get more later. And I put the Q-tips under to protect the eye glove and also to protect the eyelid, right? But because the eye glove is protected by this blue protector, right? So this is the medial or nasal, right? And then you can see that there is more, but what you don't see is any excess fat. And then again, we're gonna take more of that central, right? Because it's popping out at me. So we go until basically they retract, but we go little by little. So this is part of the central again. Okay, and now let's see if we can get. Do you see those blood vessels there? Let's see if we can get part of more with them. Oh, look, and this is the lateral is popping out at me. So let's go for it. So let's go for the lateral here. You know, and we're gonna do the same thing. So it's just little by little, right? There we go. This is the lateral, okay? And let's see. There's more here on the medial side. Yeah, maybe. Yeah. Oh, there's more on the lateral. See, it pops out nicely. Yeah, you can put your finger there. And then, see, it pops out nice. So whatever pops out, we're gonna take out, right? But you don't wanna do too much. So this is lateral again. Because if you do too much, what happens is that ends up being a hollow eyelid, you know? Or we call it cadaverized, or like a cadaver. We don't want that to be, you know, so sometimes this fat can be transposed or moved, you know, but things look good there. Let's see if anything pops out. I like it to retract, you know, but it looks good there. There's some big blood vessels there, but they're not divided. This is completely bloodless surgery. And we also look for symmetry, right? Is it about the same amount of fat on both sides?
Yes.
Yeah. And so now we're gonna measure basically what we can take out, right? Thank you.
What are you doing?
We're irrigating with saline, but notice there's absolutely no bleeding here.
No
It's
bleeding.
unbelievable. I would say this is zero, you know. We put 0.2 usually, but there is zero bleeding, not one drop of blood. Look at that, incredible. And now we're gonna measure how much we're gonna take out. Thank you. We're gonna put 0 for the blood loss because there is really 0. I mean, there's no, it's a little bit of overlap, minimal. So we're just gonna take a very, very minimal, very, very tiny, let me have the other pictures. Very, very tiny amount of skin, maybe just 1 millimeter, you guys, of skin. You know, maybe that's it. Let's see, because I don't think there is. I heard her open her eyes before surgery, you know. And but notice how I'm cutting with, and actually, why don't you go ahead and retract with this, with the suture this way. There we go. And I'm cutting with scissors, yet you don't see any bleeding at all. Look at that. And that's all we took out, you guys. And right before your eyes, zero blood loss, and that's it. You know, a little bit of excess skin. I think maybe 2 millimeters, if at all, of excess skin. Thank you. All right, so this one also has a little bit of excess skin, you know, but yeah, go ahead and retract a little more. And so now we're gonna take a little bit of this excess skin, but it's always important to just take very little, see? And we're doing maybe 2 millimeters, maybe 1 to 2 millimeters of excess skin here, you know, and that's it. And so this is basically similar to what we did on the other side. This one this is how much we're taking out, right? Very minimal. We can always do more later, but what we don't want to do is to take too much out, because then the eyelid may end up open. And these blue things are to protect the eye glove, but you can see that there is absolutely no bleeding here. This is incredible. And I just cut with scissors, yet no bleeding. Incredible. Thank you. And this is also a different type of suture, so that there is absolutely no tension here and no knots. So you should see on YouTube how we remove these sutures, right? It's almost miraculous how we remove the sutures in a matter of seconds. With the traditional technique, it takes maybe 30 minutes of digging with instruments and light source, and the patient is in pain and uncomfortable, right? And we do it here in a completely painless and very quick manner. So you can, watch suture removal by Dr. Gabriel Patino, or lower eyelid or eyelid suture removal by Dr. Gabriel Patino on YouTube. Is crazy good. But this is a different type of suture, right? So this is a suture that requires, as you can see, no knots. So you haven't seen a single knot, and we're not gonna do any knots. So I put this without knots, right? This is just incredible surgery, and just bloodless also. Thank you. This is 5-O-Proline for those doctors watching out there. This is a suture without knots. We're nuts here, but we don't put any knots. But what you don't see is any bleeding. So look how beautiful this is, and the cut is so clean. Look at that. No excess fat, no excess skin. She looks incredible, right? And so now what we're gonna do is so look at these, these sutures are placed so meticulously without any knots. So this is a special different technique. You can watch it on YouTube, suture removal by Dr. Gabriel Patino, or eyelid suture removal by Dr. Gabriel Patino. And it is miraculous how we do it in a matter of seconds, instead of 30 minutes or 45 minutes, and the patient is in pain, and you have to dig in and get the scabs out or whatever, and use a lighted source. We don't need to do any of that with these patients. And we're gonna go ahead and remove the eyelash, and then this is just incredible. So very different technique. You're gonna love it. If you would like to have a procedure like this, please give us a call, 510-525-7999. And what we're gonna do is, when I do this, I don't even need instruments. I can use a clamp to pull them out, like this, basically. So what I do is I basically grab this end and pull it out in a matter of seconds. Thank you. So we're gonna go ahead and remove this eyelid protectors, eye glove protectors, and you can see that there is no ectropion, meaning that the eyelid closes nicely and there is no, even though there is a little swelling, the eyelid closes nicely so it doesn't stay open. Ectropion means when you take too much skin out, the eyelid's still open. But she is sleeping, she had local anesthetic and general anesthetic, she looks great. Thank you.